Hi, it's Dr. Tiffany. I hope you're doing well today. So, today's topic is what it's like to be a psychologist. That is such a loaded question, but first and foremost, I absolutely love my job and would never want to do anything different. I feel so privileged to be a psychologist. I know, however, that this job isn't for everyone. It's an emotionally consuming job, but I think and feel, I know for myself for sure, that it is the most rewarding experience for me professionally. Now, I have amazing emotional experiences with my loved ones and my family, and watching my son grow up is amazing, but this is just a totally different realm altogether. And I think it's a calling. I'm a spiritual human being and a huge believer in God, and I know that God has put me on this path for a reason. Most people don't go into this profession without that calling for them, right? Sometimes we think, yes, it's cool to be a doctor and to be a psychologist. Everybody, thinks that you're reading their mind. It's not the case, not unless you write me a check, that is. But we're not, and that's not what we're doing. But people have that illusion that it's like super cool. It is super cool, but it's super cool for reasons that are completely different than that. So, with being a psychologist, what I love most about it is that people are very real and very raw with me. And I imagine with most behavioral health providers, they come in at a place in their life where they're ready to make change, where they see something that they don't like, and they want to be self introspective. They want to learn more about themselves, and most of them want to authentically live better lives. Enhancing their quality of life is so important. And many times they're not just doing it for themselves to feel good, but also to help their loved ones and to be better for their loved ones. So it's so inspiring that people want to change and that we don't have to continuously keep this veil over ourselves, kind of like a plastic face and a plastic smile, pretending things are going great when they're really not. And that authenticity is so important. I can only imagine how vulnerable it feels to sit in front of a stranger for the first time and disclose a lot of the hurt and suffering you experience. I am very empathic to that. Of course, I've been on the other end too, where I've been in my own therapy sessions, and that's so important to understand how the room shifts. You're looking at my room here. What it's like to be on this side versus that side. I think it's a hugely humbling experience, and I think it's important for us to have a psychologist. But I feel privileged that the individuals who let me into their lives do so, and they fight this sense of vulnerability. It takes a tremendous amount of courage to open up to a stranger. Sometimes I imagine it's easier opening up to a stranger because they're an objective observer into that person's life. So I'm an objective observer to my patients' lives. I think that I like to consider myself like a mirror so they can see themselves more accurately, see a good reflection of themselves, true. Sometimes that comes with the good, the bad, and the ugly, right? That's what we got to do if we're going to be real, authentic people and do what makes us happy. So I love my job. Is it challenging? Oh, yes, it's absolutely challenging. You get so emotionally invested in these patients. I like to think of myself, I do love my patients. I absolutely do. And I know love is a very powerful word, but I have this sense of love for humanity as a whole. And I respect human boundaries, of course, but it's a sense of love that I have to love you as we are children of God who are going through all this suffering together, and for that I relate to you because I have my own sufferings, and that allows me to show a love to you. And I think that love is so important when we're working with people. It's that unconditional positive regard that we have in certain circumstances. It doesn't mean I always agree with what they're saying, and I will stop and interject and say I don't agree with that, or this is my perspective on it. But I think you gotta love humanity to some degree. You gotta want to make this world, I know it sounds so cheesy, a better place. World peace! Yes, that's the answer to everything. World peace. It's true. It is. Oh, we got to figure it out together. I like to think of what we go through as the human condition. It's a challenge. We go through a lot of suffering. Sometimes others cause us to suffer. We cause ourselves to suffer. We grow up in certain kinds of environments that can cause us emotional hurt and pain and damage long term. And I love those patients who come to me who just want to change because they don't want to repeat the repetitive patterns of negativity that they've experienced their entire life. I just admire that so, so much, I love those patients. I love all my patients. Yes, I do, I do, I do. But there are those ones that you feel especially akin to who are just so motivated to change. Now, yes, I think I deflected. It is challenging. And sometimes I feel that I go into an emotional black hole with them oftentimes. And I'm trying to cast a reel out to help them catch on and then bring them back in, right? Kind of like I'm fishing. I don't even know the proper terms for fishing. But I try and bring them out. And we have to go where they go, oftentimes with the demons that we encounter in our lifetimes from traumatic events. Obviously working in the military setting, I feel like I go on a myriad of deployments time and time again. And I go with them in their own emotional war zone and battle those demons. We have to open Pandora's box and work through it. And sometimes we just break down and it's challenging, but we don't give up. We don't avoid. We keep working through. And when we do that, when we really do with that true intention, it never fails. Something good always comes out of it, especially through processing. It is a challenging job, but there's nothing better than when you can be a part of giving the gift of insight to somebody else. It's amazing. It's definitely a calling, and I will do this over and over again just for the addiction of that insight and seeing them make that aha moment and make changes in their lives and see people respond to them improving. Psychology is a lot of textbook, obviously, a lot of studying, understanding human behavior, cognitions, emotions, and of course the neurobiology behind brain functioning. It's a lot of textbook, but much of what we do also comes from an intuitive sense and an emotional sense and a very human sense. It's such a soft science, really, it truly is. And so it takes a certain person to be able to do that. And I know that there are amazing behavioral health providers out there, and good God, I think they're blessings to all of us. But it's an amazing field. It's exhausting, but super rewarding because every time you're exhausted, something happens in a session that completely fills your cup and brings you back up. I think one of the most important things that I do professionally for myself is try and find that balance, that work-life balance. It's something that we absolutely have to focus on. It's being mindful. My faith and my spirituality is so important. Before every session, I ask God to give me the guidance and the strength to get through it and to help me be a messenger to whatever positivity, the Lord wants to provide. I don't always talk about God in all my sessions. If it's important to the patient, I will. But if it's not something that's important to their reality, I keep it to myself, but it doesn't mean I don't say a prayer. So, in short, I do absolutely love what I do, and I wouldn't want to have any other job. Okay? Well, I hope this kind of answered your question on what it's like to be on the other side of this. And if you have any questions, comments, or concerns, go ahead and put them down. Please subscribe to my YouTube channel. Don't forget, it's all about love. I am so serious. It is all about love. So push the love forward.